Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to our event this evening. Excited to hear from you, your questions, and I hope we'll be able to give you some great answers and that will bring some clarity at this time when sometimes things can be very confusing. Our whole goal of our company is to really help people to make sure that you understand your Medicare options, your choices, because they have consequences. And so we want to make sure that people, when they go on Medicare, they're going on at the right time and making the right insurance decisions. And so I trust tonight's event will be helpful in that way. Those of you that are new to our group, just a couple things. Number one, we are going to get into questions, but before I do, I'm going to have one topic I just want to discuss a little bit. And you can ask further questions about this topic or really anything else that you want to talk about Medicare related or Social Security related. All right, so here's what I'm going to ask of you. Be sure that as you put your questions in the chat, that it is very obvious to me what the question is. Sometimes people, they try to be brief like they were sending a text or something. And if I cannot figure your question out, then you've been too abbreviated. Okay, make it clear so that I can give you accurate answers. Otherwise, I have to skip over some of those that just simply do not make sense. All right, so do that for me. And then secondly, I do want you to know a couple things. If you're very new to us, I want you to know that we'd love to have you be part of our Facebook group. Of course, there's no cost to do that, but we'd love to have you be in. I think right now we have well over 50,000 people part of our Facebook group, and that's an awesome way to connect with others, to learn what others have experienced as they have gone on Medicare, as well as get some expert advice through that group as well. And then also, and lastly, and I'll get started, if we never have visited our YouTube channel, we have one. In fact, I think right now we have the largest YouTube channel in America with Medicare, and so we're grateful for that. Many of you have told others about us, and it's just grown over the last several years. So we would be delighted for you to go to that channel and learn more about Medicare. There's a lot to be had, a lot to know. And so this would give you some wonderful resources on our YouTube channel, just MedicareSchool.com. And then those of you that would like to kind of see a condensed version of a workshop that I do, and I've trained millions of people across America with Medicare, and every year I reshoot a version of that year's Medicare numbers. That's called the Medicare Essentials Workshop. And so I, of course, have done 2025 already, and so it's there on our website, MedicareSchool.com. It's called the Essentials Workshop. I think it's about 50 minutes or so, just right at that. And truly, you would get a wonderful, basic, good knowledge of the Medicare system. And so if you don't feel like you have that, go to our website sometime and avail yourself of that particular video. It's very, very helpful. All right, so I'm going to get started tonight, and then I'll take your questions, so you can start putting those in the chat if you would like. The topic is staying on the employer plan after 65 and the biggest mistake you're making. All right, so I want to deal with this whole issue of staying on an employer plan at 65. So first off, as I introduce this, let's be real clear, folks, that the only group of people that does not have to go on Medicare at 65 are those that are working or their spouse is still working and you plan to continue to work for a while. And you are covered by an employer-provided insurance plan at work that has 20 or more employees on the payroll. So the company size is determined by Medicare, and it's not how many people on the plan, it's how many people are on your company's payroll. And if it's 20 employees on the payroll or more, and that could be full-time, part-time, doesn't matter, on the payroll, or more than 20, then what happens is that's considered to be a large employer by Medicare. Okay, large employer. So that means if you're still working or your spouse is covered by a plan that there's 19 employees or fewer on the payroll, that's considered a small employer plan. And in that scenario where you're covered by a small employer plan, you have to start Medicare at 65. A and B is required. Why? Because small employers' plans are only obligated to pay in the second payer position. Medicare says they will pay first. And so you have to put Medicare A and B in the first payer position. You've got to enroll in A and B at 65 if you have a small employer type plan. And if you don't, you claim ignorance of the law and don't understand the rule, it doesn't matter. I can assure you, if you had a large claim that came through, that small employer insurance company, whoever it is, they only have to pay second, and Medicare pays first. So if you didn't enroll into Medicare A and B, you become the first payer. And folks, I have seen that time and time again. Okay, and by the way, just so you know, anyone that's on COBRA is in the same position. COBRA only pays second to Medicare, got to go on Medicare at 65 to put them in the first payer position. Anyone that's covered by TRICARE, you're retired from the military, you have TRICARE insurance, same thing. TRICARE moves to the second payer position, A and B pays first. It's just the way that it works. All right. Now, it's obvious if you or a spouse are no longer working, you're going to enroll into Medicare A and B anyways. You just have to. But my whole point is that there are some people that don't have to go on Medicare at 65, but those people are only those who are covered by an employer-provided plan, 20 or more on the payroll. All right. And so that's what we're going to talk about tonight. So the rules have to do with people that are on these plans where they don't have to go on Medicare. So first off, know this: you do not have to take Medicare A or B if you're covered by a large employer plan. Not A, not B. Now, I know many of you have heard that you have to at least take A, and if you don't take A only, you're going to be penalized. And folks, that's absolutely not true. It's not true. You see, the only people that are ever penalized on Medicare A are those that have to buy A. They have to pay a premium for Part A. And you realize that's only 1% of the Medicare population? Folks, there's over 70 million people today that are on Medicare. And only 1% of the Medicare population actually has to pay a premium for Medicare A. And that's the only group that will ever be penalized for A if they don't start at 65 or start at retirement. Okay, so those who buy it could be penalized, but as long as it's zero premium to you, we're not supposed to say free because you've paid for it all your life through Medicare taxes, through FICA taxes or self-employment taxes. But as long as it's zero premium and you have that because you paid into the Medicare tax system for at least 40 quarters, we get 4 quarters a year. That's the most we can get in a year. And so as long as we've paid in that tax system for at least 10 years, you will absolutely get your Medicare Part A, zero premium, and you'll never be penalized no matter when you take it. All right. And so that's a fact. So the reason this matters is because there are some of you that are going to keep working, or your spouse is going to keep working, and you do not have to do A and you don't have to do B, and you would be actually making a mistake if you take A only at 65 if you are contributing or your spouse is contributing to a health savings account, HSAs. They're wonderful pre-tax methods for accumulating pre-tax money for present and future medical expenses. They're like a healthcare IRA. I love HSAs. Now, I know not everyone has that as an option, but many of you do. You have a high deductible health plan, an HSA option that you can put money into, so maybe your employer's also putting money in. But here's what happens. If you enroll into A only, you can put no new money into your HSA. Now, listen, that HSA money is yours. No one's going to take it from you, but no new money can go in. And so if you do have an HSA, don't do A, don't do B, keep putting money into your HSA. I love that. It's pre-tax when it goes in, tax deductible, meaning if it's a growth account, some of them are, it grows tax deferred. And once you pull money out of it, as long as it's going for a qualified medical expense, it's tax free forever. Okay, totally. And so they're just wonderful ways to save money for healthcare expenses. And so I love HSAs. Now, if you don't have an HSA and you or your spouse are going to keep working past 65, then it's fine to enroll into A only. No problem. As long as you don't have HSA, I like and encourage people to take A only. A only in a situation like that where your employers are 20 or more, A only is only going to pay second. Your group plan at work still pays first, but that A only may pay something on a hospital claim. It won't pay deductibles, it won't pay copays, but it will pay coinsurance. And so I think it's a good thing to do, especially if it's going to be zero premium to you. So that's a situation where you can enroll into A only. But again, I share all this with you because so many people here, they've got to take A, and if they don't, they're going to be penalized, and it's absolutely not true. As long as you or your spouse have 40 quarters, you'll never be penalized on Medicare A. All right, so that's the way it works. Folks, I'm going to pause for just a second. We're having a kind of a technical difficulty here And Brigitte, can you hear me? Brigitte is one of our coworkers, and she is the one that's going to feed me questions, but I can't see that you're with me, Brigitte. So if not, I can, of course, take care of this on my own, no problem. But okay, so let's get back to the topic. Brigitte, I can't see that you're with me tonight, so in some way, if you can either text me or something, let me know. Otherwise, I will proceed by myself. Okay, so let's go back and let's talk about this biggest mistake that you're making. So number one, don't enroll into A-only if you have an HSA. Don't do that. That's a huge mistake. And then also what happens, let's suppose that you're in a situation where you are going to stay on your employer-provided plan, but you are already receiving Social Security. Or maybe you're receiving Social Security and you happen to be covered by your spouse's employer-provided plan. Which means what? Folks, anyone that is on Social Security is automatically enrolled into Medicare A and B, automatically. And your Medicare card shows up about 3.5 months, about 100 days prior to your birth month, your 65th birth month. It's going to show up. And so if you're on Social Security, you're automatically enrolled into Medicare A and B. And one of the biggest mistakes people can do is, if they have a good group plan, I recommend them not keeping A and B. Now, if you're on Social Security, you have to keep A only, but you don't have to keep your B. So if you're automatically enrolled into A and B and you have a good group plan, 20 or more, A and B's in the second payer position, and you're having to pay a premium for your Part B that's going to come out of your Social Security check. This year, it's $185 a month. And you're paying $185 a month for Part B when it's probably not going to pay much of anything if you have a good group plan. So I think it's a huge mistake if you have a good group plan to keep your Medicare B. So what you can do is you can disenroll from Part B. Again, if the group plan's good and your spouse is working, you're working, you still have, you're going to plan to continue to work, drop off the B. There's two ways you do that. If you just got your card, you actually have the opportunity to turn the card over, and it gives you the opportunity to check a box, sign your name, and you can disenroll from Part B. It says, I do not want medical insurance, which is Part B. And you can mail the card back in to Medicare. They will drop off your B. They'll send you back a new card that says Medicare A only, and you can pick up Part B at a later date. When you retire, your spouse retires. And so in that scenario, I would disenroll from Part B. Now, there's a second way you can disenroll from Part B, and that is to fill out a form called a 1763, Form CMS 1763. And on that form, you just simply would let them know that you want to drop Part B and when you want to do that. You mail that in or fax or drop it off at a local Social Security office. And that's the other way you can drop off your Part B. Now listen, folks, the only one that could do this and should do this are those that are covered by good group plans. And so if you have a good group plan, and how I define that is someone that has a good network. The premium that you're paying is very reasonable. You're happy with the coverage, a good group plan at a good price. My price point kind of is around $250 a month or less per person. That's probably a pretty good option, especially if it has a low deductible. If that's you, then again, I would disenroll from B, pick it up at a later date. So as long as we can prove down the road that you've had credible insurance coverage back to 65, you'll have no problem picking up B at a later date. That is called a special enrollment period. Again, credible insurance coverage, you were working, spouse is working, covered by a group plan. Again, you'll have no problems whatsoever. I would drop off the Medicare B. Now, if you have let's say a lousy or a mediocre or an expensive group plan, then I probably would drop the group plan and just take Medicare. I think that's a real good decision for some of you. Now, if you do drop the group plan, just remember it's going to affect your spouse if they're covered by the plan, or your kids up to age 26 covered by the plan. And so you may not have that option, but as long as no one's going to be hurt by you dropping the group plan, you have every right to go on Medicare at 65. So what you should do, and we're happy to help you with this, make a comparison, folks. Let's lay the group plan features together and the Medicare features together, and let's compare the price. What's the premium? What are you paying for it? What's your deductible? Do you ever meet that? What's What's your max out of pocket? If you got cancer, how much exposure do you have? How are your medications covered? So we just simply lay those side by side, do an analysis. Does it make sense to go on Medicare? And sometimes it does, and sometimes it doesn't. If you want to call in and talk to us about that, I promise you, we'll be honest with you. We'll give you say, hey, stay on your group plan. It's a wonderful plan, great option. Stay there. And others of you would say, hey, you know what? Medicare is probably a better option for you, something you may want to seriously consider. All right. And so again, those are some of the mistakes that people are making when it comes to employer-provided plans. Again, some will stay, but some may want to get off of those. Those of you who have an HSA, don't do anything whatsoever. I promise you won't be penalized. Those of you that are on Social Security, if you have a good group plan, again, mail the card back in, disenroll from B, and just have A only. All right, so that's enough for that. I'm gonna stop yakking about all this. Hopefully it was helpful. Hopefully it made sense. And so I am now ready to take questions. And I'm really sorry. Okay, so I think Brigitte is on now, so I think she's going to be able to feed me these questions. So, Brigitte, are they going to show up on the screen, or here we go. I'm ready. Okay, William. William, thanks again. I know you join in regularly. Appreciate your input and question tonight. Okay, can you use your Plan G or MA plan for second and even third opinions? Would that be considered medically necessary and be covered? All right, so here's the way it works. Number one, when it comes to a second opinion, Medicare does allow that. And so if Medicare allows it, then your G plan would be second to Medicare on a second opinion, for sure. Now, when it comes to the MA plans, those are Medicare Advantage. William, and you probably know this, there's almost 4,000, actually 3,800 different Advantage plans in the country. And there's about 10 different companies that dominate that market, but the point is there's lots of plans, so there's no way that I would be able to accurately tell you which ones would allow that. And by the way, I have never heard of someone on a third opinion. I'm not saying it doesn't happen. I've just never had a client do that, but I do know on a second opinion, Medicare allows it, and your G plan for sure would pay the portion that was left, of the Medicare balance. And so you would have to actually call a Medicare Advantage company that you're with and see what their rules would be on second opinions. I just can't speak to that generally because it is going to vary. I think some would, some may not. Some may have a pre-authorization attached to that second opinion. So again, that would be the way I would answer that question. Okay, Brigitte, let's keep going. All righty. Bruce, just turned 69, signed up for Medicare A and B. Since I'm now no longer covered by an employer plan, they will pay for COBRA coverage, so I wonder if I can be both on Medicare plan and COBRA. Okay, Bruce, you're in a very, very critical position, okay? Okay, so you signed up for A and B, you have COBRA, and so it is fine. Number one, just know that because you signed up for A and B, you did the right thing. And the reason for that is because as soon as your employer plan ends, your COBRA coverage moves to the second payer position. I mean, it is truly second now. So had you not enrolled in A and B and you had a claim, you would have been the first payer. You're not, because you took A and B wisely. And that COBRA plan is going to pay second to Medicare. Here's your key, though, Bruce. And again, I don't know if you have a spouse covered by the employer plan, but let's say right now I'm just dealing with you. You would not, in my opinion, want to stay on that COBRA plan any longer than 6 months, even if the employer is paying full price for it. Listen, you do not want to miss what is called the Medigap open enrollment period. If you decide that you want a Medigap policy, you have 6 months, Bruce, of your B date. Not your A date, but your B date, where you can get any Medigap policy sold in your state, any carrier, any company. Now, of course, you're not going to be able to get a C, Medigap C or Medigap F. Those would be off limits to you. But you can get all the other Medigap options. Most people today get a Medigap G or a Medigap N, and you can get those regardless of your health conditions during the 6-month window of your B date. And so if you were to extend your COBRA, let's say beyond 6 months, what's going to happen? COBRA will still pay as long as it has not been terminated, but you just lost this once-in-a-lifetime opportunity to get a Medigap policy with no underwriting. That's called the Medigap OEP. So again, if COBRA's paid for, let's take that to the limit, but no more than 6 months of B. So let's just say, let me just make this up. Let's say your B date is May 1. We count May as one of our 6 months. So if it's May 1, we got May, June, July, August, September, October. So towards the middle to the end of October, you would be applying for a Medigap policy, again, probably G or N, that would go into effect November 1. And during that 6-month window, no underwriting. But if you wait to apply for a Medigap policy after November 1, I promise you, Bruce, unless you live in New York, Connecticut, Maine, or Massachusetts, you will have to go through underwriting. If you have some health issue going on, you may not be able to get that. So you just miss that opportunity. All right. So we see people make that mistake all the time. And it's a heartbreaker for those that have some serious health problems. Okay, let's keep going. All right, Bob, question on HSA. And Medicare start date, 6-month rule. My final HSA deposit was 12/31/24 using SEP. Can I sign up now and start at Medicare an 8/1 or wait till 7/1 to sign up and start Medicare? Okay, first off, you are right in that they are going to, HSA contribution rules. Your deposit was 12/31. Just so you know, hear me out though, Bob. I'm going to answer your question, but your HSA contributions really have nothing to do with your B date. They're both kind of separate decisions. They're both very important, so I just want to make sure you're clear about that. So what happens is if you sign up now and for Medicare, and today is 4/23/2025, and you start and you enroll right now into A or B or just B, it doesn't matter. You'll do A and B at this time. If you what they're going to do is they're going to backdate your A date 6 months. So if you enrolled today, let's go 1, 2, 3, 4, 5, 6. You're going to have 3, 2, 1, 12, 11, 10. All right, so you're going to have an A date of 10/1 of 2024. That will be your A date, okay? Which meant that that you were really no longer eligible to put money into an HSA effective 10/1 of 2024, okay? Because the backdating of the A date is always 6 months from when you apply, not when you want your coverage to start. It's 6 months from when you apply. Now, Bob, this only matters if you're maxing out, okay? Because you can put in right now about $430 a month. Remember, the individual contribution is $4,300 plus $1,000 catch-up. So you can put in $430 a month. So if you're maxing out every month, well, then you really should have only contributed 9 months and no more after that. But if you didn't max out, that 9 months times $430 would have been, 36, basically almost $4,000. So as long as you didn't put in more than $4,000 all of 2024, you're still going to be fine, even if they backdate to 10/1. Now, let's suppose, Bob, you apply in July or June, whatever. Let's just say July 1, and you apply in July. Then what they're going to do is they're going to hang on just a second. They're going to backdate 6 months from that date. So that'd be 1, 2, 3, 4, 5, 6. That's 6, 5, 4, 3, 2, 1. You would have an A date of 1/1/2025. 1/1/2025. So again, they're going to backdate it 6 months from when you enroll. So if you want your Medicare to start 8/1, you could still enroll in 7/1. If you indeed had fully funded your HSA for 2024, that's the way you would handle that. Okay, now let's talk about the B rule. See, the backdating of the A date has nothing to do with the 6-month Medigap OEP. It's all tied to the B date. So if you started at 8/1 or 7/1, it doesn't matter. Well, you select your B date, and you're doing that through either the IP enrollment or you're doing that through the SEP enrollment. You select your B date, and then we have that 6-month window where there's no underwriting involved. That's why I elaborated on these two separate decisions. Yeah, there's a little intertwining here, but they're all separate as well. Okay, so hope that helps. That's a long answer, but it's just a confusing situation. Okay, Brigitte, let's keep going. All right, I was thinking I could change it later to a different carrier if I wanted, but I was told that I may have to go through vetting to change carriers. Is that true? Okay, Jack, it really just depends on where you live. What happens is there are some states, and there's about a dozen of them today, that have what we call birthday rules. And for those of you that are new to this topic, what he's saying is that let's say I start with a G plan or an N plan and my premium goes up. Can I change carriers or change plans without underwriting? And the answer is yes, if you live in a birthday rule state. Now, Missouri is called an anniversary rule state, so it's tied to the anniversary of the policy. In most states, it's tied to your birthday. Now, again, I'm going to rattle off a couple of the states. The 3 West Coast states are all birthday rule states. That would be California, Oregon, Washington, Idaho, Nevada is a birthday rule state. Oklahoma is. Missouri's anniversary rule state. Louisiana, Illinois, Kentucky, Maryland, Virginia will be soon. So the point is, if you live in a state that's a birthday rule state, or Missouri where it's anniversary rule, that window around your birth date, and again, every state's different. Some states it's 30 days before your birth date and 60 days after. Some states it's 60 days after your birthday. But around the birthday, you can usually change insurance companies as well as plans, like to less. So if I have a G plan, I can move to a G or to an N. If I have an N plan, I can move to an N, but I can't go to a G. So it's like to like or like to less, and you can usually change carriers. Now, Louisiana, got to stay with the same carrier. Illinois, got to stay with the same carrier. So again, it's going to vary. But all I'm trying to teach you is that if you live in a birthday rule state, there could be a window of opportunity where you can change insurance companies with no underwriting. Now, if I don't live in a birthday rule state, where I'm sitting right now doing this this event, I'm sitting in our home office in Overland Park, Kansas. This is not a birthday rule state. So what happens in this state, as well as the majority of states, once you have a supplemental plan and that 6-month window is beyond the B date, and now you want to get a supplemental plan, now we are going to have to go through what you're calling the vetting. We just call it the underwriting process. So 6 months after the B date has now terminated, now to change carriers, to get a supplemental plan, to do whatever, supplemental, now we're going to have to medically qualify. 40 health questions, check your medications, get a statement from your doctor. So we got to go through that process or we can't switch. All right, so great question, Jack. I hope that helped. All right, let's keep going, Jay. Ken, I have an HSA with my employer. I'm 66, will work for another 2 years. When should I get Medicare? Well, when you retire. So, Ken, what I would do, let's just say you're going to work for another 2 years, and let's just say it's going to be May of 2027. All right, let's just pick that date. So 2 years out. So we'd like our Medicare to begin. And Ken, as long as your group plan is a good plan, then I would keep that group plan as long as you can. And once you retire, they normally cover you during the full month. So let's say you're going to retire April 25th. And your insurance will cover you through the end of April. So we would want our Medicare to start in 5/1 of 2020, let's say 2027. Now, if I want to start in May of 2027, I'm going to apply before then. So let's say we decide to apply 2 months before we actually start. So that means if we're going to start 5/1, we're going to apply during the month of March. All right, and March of 2027. And what they're going to do is they're going to backdate your A date 6 months. Okay. From when you apply. That's what I was just saying earlier. So let's back it up 6 months from March. 1, 2, 3, 4, 5, 6. That's going to be 2, 1, 12, 11, 10, 9. And we're going to have an A date of 9/1 of 2026. So you were fine to max out your HSA all the way up until August of 2026. But once that A date starts, no new money can go in if you're maxing out. Now, if you're only putting in $100 a month, it's not a big deal. But if you're maxing, then you don't want to overfund that HSA. So keep contributing to your HSA. Max out if you want to. But once you know you've set that retirement date, you feel like you've got that date, let's back up the clock 2 months because you'll probably start applying 2 months in advance. And from that date, back up 6 months, that will be your A date. And then you want to make sure no new contributions, if you're maxing out, go in after that A date. And by the way, can you work with us? We'll guide you through this whole process. But keep the employer plan if it's a good one, and then start your Medicare on the 1st of the month after your employer plan terminates. All right, let's keep going. All right, Janet, is there any help with Part B premiums? I'll be on Medicare in June, disabled in 64, and we'll have Medicaid secondary and would be able to help. And would you be able to help applying for such? No, Janet, we can help you with lots of things, okay? But when it comes to Medicaid, you would need to apply for that through your state. Sounds like you already have that. So depending upon your status, because there's different levels of Medicaid help. but these are called, of course, Medicaid as well as Medicare Savings Program. Medicare Savings Program, and you apply for those through Medicare, or you can actually apply through your Medicaid office as well with the state. And if you qualify at a certain level, they actually will help cover all the expense of your Medicare Part B. They'll also help you with Part D plans as well, with premiums as well as reduced out-of-pocket expenses on drug plans. So be sure you've applied for that help, because a lot of state Medicaid offices will help offset those expenses. So be sure you to make application, and then they will let you know. And again, we can't do that for you. Now, I can tell you, once you're got all that set up, there are two ways in which most people go with Medicare Medicaid plans. You can get what's called a dual SNP plan. SNP is an acronym for Special Needs Plan. That's a Medicare Medicaid plan. Those are very attractive in lots of places. Or, depending upon your health situation, we may be able to do what's called a chronic SNP plan. Chronic means you have a chronic condition, and we're able to get you a plan that's specifically to help give you certain benefits for certain diseases. And so those are dual SNPs and chronic SNP plans. We write those, Janet, all over the country. So if you want to call in, we'd be happy to help with that part of it. But again, it's going to have to be Medicare or Medicaid that's going to make that application for you to see if you can get help with Part B and Part D. All right, Brigitte, let's keep going. Tim, I'm collecting Social Security, I'm 69. My employer withholds for Social Security and Medicare. Is this correct? Do I get the withholding back since I'm already on Social Security and Medicare? No, Tim, it is correct. I mean, your employer is doing the right thing, because all of our income, that is wages, is going to be subject to Social Security taxes. So they have to withhold. Okay, they have to. They don't have a choice, even though you're collecting. But what's happening, Tim, is as you continue to work and pay into Social Security, what they're doing is each year they're recalculating your Social Security benefit, because it's always our top 35 years. And so what happens, if I have a year that's higher than a previous 35 years, it'll knock out the lower earnings year, and they'll recalculate my benefit on an annual basis. And just so everyone knows, they do this after age 60. After age 60, they continue to recalculate our benefits as we continue to work past 60. So your Medicare taxes continue on as well. These are called FICA taxes. 1.45% paid by you. Employer's going to match that. Now, the employer on the Social Security, you pay 6.2. They match 6.2 up to $176,100 of income. So they're doing it correctly, but it is benefiting you because your Social Security check may come up if indeed you're making more in some of these years than you were previously. All right, great question, Tim. Let's keep going. Okay, when should I begin signing up for Part B if I'm retiring 9/30/2025? Well, let's back up the clock. So here's what's happening. You're retiring 9/30. You want your Medicare to start 10/1/2025. Now, again, Gloria, I don't know how old you are. Okay, but regardless, a good general rule of thumb is 3 months before. So if I want to start 10/1/987, I would start looking at all this after July 1. And so what I would do is reach out to us, Glory, and get on our calendar. We'll help you, whether you're coming in at 65 or 67. It's a different enrollment process, and we can do all that for you. So you could reach out to us and get on a calendar. Maybe an appointment for June, but officially your window opens up about 90 days prior to when you want your coverage to begin. So you'd want an appointment either towards the latter part of June or right after July 1 would be the perfect time for you. And to reach out to us, and all of our services are totally free to you. Be happy to help you. And the good thing is it'll be done correctly. You don't have to guess. You don't have to get bad advice. Our agents know how to do this. We do it every day, all day long. All right, let's keep going. All right, Pat, I am planning to take my employer insurance into retirement as my Medicare supplemental plan. Thoughts? Well, if it's a good plan, if it's a competitive plan, then no problem. I've seen some of those. Now, sometimes they force you onto Advantage plans. If you can get a supplemental plan and can afford it, I think subs are better than Advantage plans in most situations. But some people can't afford the premium for a supplemental plan. So you may select an Advantage plan. A lot of you are on those, and they're certainly fine insurance. But in your situation, I would want to find out, is it paying second to A and B, or is it a Medicare Advantage plan? Now, truly, lots of retirement employer-provided plans are Advantage plans. And so you have to know how that's going to work. Are you happy with the network? Are you happy with the max out of pocket? There's a lot of variables that go into that. And so if you say, yes, I like that plan, well, it's perfectly fine to do it. You've got to enroll in A and B regardless. And so is that retirement plan going to pay second? If it is there a premium for that secondary coverage? What are the terms of that? I'd want to know that. And so if you want to make a comparison, Pat, just call in. Once you know the details of that retiree insurance, then we can tell you about just the normal Medicare market. So you asked me my thoughts. My thoughts are I would be sure to do a comparison. And our agents would be honest with you. If you have a good retiree plan, we'll let you know, and we'll tell you stay on it. But if you don't, then we'll tell you why. All right, let's keep going. Timothy, I'm retired from federal government. My wife is 53, still working, and is covered by my retirement coverage as well as my stepdaughter. Do I have to take it? Do I have to take it when I turn 65 soon? Okay, well, here's the way it's going to work. Your spouse is eligible to stay on your FEHB plan called Federal Employee Health Benefits, whether you have GEA Hall, Blue Cross, whoever you have. As long as you stay enrolled in FEHB and you're paying your premiums, then there's no issue whatsoever. Now, Tim, what I would do if I were you is for your part of it, I would take A and B, and on your claims, I would have A and B first, and then I would have your FEHB benefits as in the second payer position. I know you don't have to. I know there's federal employees that have A only. I don't like that option. I think it's much smarter, less risky to take A and B at 65 as long as you're in a retire course, and let A and B be first. Let your FEHB plan, whoever that is, again, GEHAL, Blue Cross, whoever, be second. And then for your wife and daughter, then your FEHB will just be in the first payer position. To me, that's the smartest position. All right, let's keep going. All right, what about SSDI and Medicare, Medicaid? Okay, well, Social Security disability, what happens is if you're on Social Security disability and had been receiving payments from that system for 25 months, you automatically are enrolled into Medicare A and B on the 25th month, regardless of age. The same thing happens with people, well, I shouldn't say it that way. People that have Lou Gehrig's disease and permanent kidney failure start Medicare also at any age, and theirs is immediate. But SSDI, it's the 25th month of having received those payments. And so what happens then, you have to make a decision, do you just want A and B only? And so in some states, your only option is to have a Medicare Advantage plan. Other states insurance companies offer supplemental plans in the state. Again, it varies. Most states, you can't even get a Medigap policy unless you're 65 or above. Again, there are exceptions to that. So as far as Medicaid goes, if you qualify for Medicaid, then what I would do is on that 25th month, you have A and B, and then your Medicaid is going to pay second. Now, what a lot of people do that have Medicaid in the second payer position, instead of using A and B, they will enroll into a Medicare Advantage plan called a Medicare C plan. So my point is Medicaid will coordinate benefits either with A and B, or they'll coordinate that with an Advantage plan. And the reason many people that have Medicaid will enroll into Advantage plan for that coordination is because of some of the additional benefits offered by the Medicare Advantage plan that original Medicare doesn't offer and that Medicaid doesn't offer. A gym membership, hearing aids, dental allowance, vision allowance. So you've got these perks that come with Medicare Advantage plans. And so in that scenario, Medicare Advantage plays first, and then Medicaid will also pay. All right, so that's the way they work. And now that's confusing, I know. But again, give us a call, and our agents could clarify that for you as well. But hopefully that helps some. All right, let's keep going. Okay, disabled with Social Security and Medicare for 15 years. Got it. Covered by wife employer health for 22 years. She's retiring in December. Medicare is second to my employer. Okay. Got it. Her employer. Can I get subplan when she retires without underwriting? Okay. It just depends on where you live and how old you are. Okay. If you are 65 and above, the answer is yes, you can. Because once you lose an employer-provided plan, you're in what's called a guaranteed issue period of time where you can get a supplemental plan of your choosing. Yeah, you can do that, guaranteed issue. If you are below 65, still, when she retires, then in most states, you can only get an Advantage plan, but when you turn 65 yourself, then you'd be able to get a supplemental plan. All right, so let me say it again. If you're over 65 now, yes, you have a guaranteed issue right. Now, here's that guaranteed issue right. If you started Medicare before 1/1/2020, you're guaranteed issue with no underwriting on an F plan. If you started Medicare after 1/1/2020, which I doubt you did, then you can get a G plan. So it sounds like to me you can get a plan as long as you're over 65 without underwriting, but it will have to be an F plan. All right. But again, if you have some health problems, I know Fs are a little bit higher right now, but it still will probably make sense to do it that direction. But if you're not yet 65, then you may only be able to get an Advantage plan. Because there are many, many states that don't require insurance companies to offer Medicare supplemental plans for those that are below 65, even those that are coming off employer plans. All right? So it depends upon your age, depends on what state you live in. And Sam, call us, okay? We write in all 50 states. So on my agent, once you tell them that information, they'll tell you exactly what your options will be. Okay? We'd be delighted to give some assistance to you. All right, let's go. Okay, what you said about not signing up for A only, somebody needs to tell the Social Security Administration because when you turn 65, they practically threaten you. Well, you know what, Mike? You're right. You're exactly right. And the reason they do that, honestly, is because sometimes there are people in Social Security offices that just are not trained well. I've been in this business 16 years, and I'm also a financial and investment advisor. So I've dealt with Social Security for a long time, and there, frankly, are just people that are rookies, or maybe they've been there a while, but they're just not up to date on their rules. And you're right, you will get bad information sometimes. Now, not always. There's some people in Social Security offices that are very, very sharp. They know their business, but if they know their business, they will tell you exactly what I said, that you don't have to take A. But a rookie who on answering questions on the phone just hasn't learned that yet. But again, it only matters if you have an HSA. If you don't have an HSA, and it's only 10 or 15% of the population that even have HSAs. So as a general rule, they may be giving people accurate information, but those that have an HSA, they're hurting them. They just causing those people to shoot themselves in the foot by saying they're being penalized, and they're not. I mean, very rarely are people penalized on A because, again, 40 quarters, you'll never penalize no matter when. All right, so you're right. I wish, hey, I'll tell you an interesting story. We've had people from Social Security call our company and say that their superiors actually told them to go to our YouTube channel and learn, okay, using our resource, which we're happy for that. They'll go to our YouTube channel and learn about Social Security, and they work for Social Security. Just amazing to me, but just kind of a sad state of affairs. Let's keep going. All right, Hector, if I'm not working and I don't have any insurance, can I enroll in Part A only and then delay enrolling for 2 or 3 months in IEP? 65th birthday is in June 25 without any problem. Yes, you can. So let's go through it together. So first off, you say your birthday is in June. So if it's June 1, then what I'm getting ready to tell you, you're going to have to back up the clock to May, because when someone's born on the first day of the month, they actually start their Medicare the month prior. So I'm assuming, Hector, you're born June 2nd through the 30th, okay? So if we have a June birthday, let's back up 3 months. So that'd be 5, 4, 3. And let's go forward 3 months, 7, 8, 9. All right, so what you're saying, yes, you can enroll into A only, and you can do that now, no problem. And if you're not taking Social Security, then you do your online application, and they're asking you, do you want to do B? And you say no to that, which you can. You're going to notice they're going to give you a warning sign saying, hey, are you sure you want to do this? You could be penalized. And so it's all right. You can say no to B. But here's what you're going to do. You're going to enroll online into A only. And you said your birthday is in June, so 79. So then the latest, here's what you're going to do during the month of September. Hector, you can enroll into Medicare B using one form called the CMS 40B. CMS 40B during the month of September, and then you will start your Medicare October 1. All right? So again, we're saying your birthday is June, so we got 7, 8, 9. So that means that's the last month of our IEP. You submit your 40B form and submit it to a local Social Security office. And on that form, you say, please begin my Medicare, 7, 789. Please begin my Medicare October 1. That'd be please begin my Medicare B October 1, 2025, and you won't have any problems. Okay? Yellow A only, online. B, we submit that CMS 40B form. Okay? And that goes to your local office. Now listen, Hector, if it were me, if the office is reasonably close, I would drop it off for sure. If you don't do it that way and you mail it in, I would also fax it in. Or if you fax it in, I also would mail it in. I'm telling you, when you only fax in, we've had plenty of them get lost. So I like to always back up with a mailed copy as well. So we fax in and then mail it saying, hey, we've sent this by fax, but we want to make sure you got it because you may not get a confirmation. Okay, so the best thing to do is take it to a local office. You don't have to have an appointment to do that. They're open 9 to 4, most offices 9 to 4, Monday to Friday. And put an envelope, make sure you have a copy of the paperwork, and drop it off. And usually there's a guard there that will take the paperwork, and you just put on the outside application for Medicare B. And they'll get it in and get it processed. All right? Okay, let's keep going. We're on my husband's retirement group plan insurance. Do we need Medicare B? Absolutely. Yeah, because what happens, now let me back up. Unless you're retired from the federal government, absolutely you must. Because any retirement plan other than the federal government, FEHB benefits, will only pay second to Medicare. Okay? So unless you work for the government or had, then you must enroll in A and B because that retirement group plan will only pay second, I promise you. Now, when the federal government's involved, you have FHB benefits, then what happens is if someone enrolls in A only, then the FEHB insurance pays second to A, but if we we don't enroll into B, federal employee, retired, then the FEHB will pay first, and then the insured becomes the second payer. That's the way it works. But they're the only ones that can get by with that. Everyone else, you want A and B. Okay, let's keep going. Okay, will Medicare cover injury as a result of an accident? Yes. Say, for example, a vehicle accident or breaking a leg at home due to a fall or slipping on ice. Okay. All right. So before I said yes, I should have clarified. So here's what happens. If it's a vehicle accident, what's going to happen is Medicare is not going to pay that. They're going to want the auto policy to pay for that. Okay. Now, if the auto policy did not, for whatever reason, then I would suspect that Medicare may have some involvement. But as a general rule, what happens, in fact, let me just give you a great example. We've had people that had a car accident, let's say at 63, and they had insurance, car insurance, auto policy paid, maybe their own health policy paid. Now they're on Medicare. And they still have some recurring issues going on because of that injury. Medicare will deny those claims, and it's going to go back to that, again, auto policy, insurance company, just the way Medicare works. So on vehicle accidents, they're different because we have other insurance that Medicare is saying, hey, we're not liable for that. Now, break a leg at home due to a fall, then that's going to be covered by Medicare. Now, let's say that you were in a shopping center, and there was negligence at a shopping center, and there was a suit over that, and then the shopping center took the responsibility of that, then their liability insurance would be responsible for that claim. Okay, so if there's an injury accident as a result of some other issue going on, then if there is other insurance that was liable, then Medicare is going to not pay. They will say, no, we will not. Okay, so sorry that I spoke a little bit too quickly there. I didn't fully read the question. All right, let's keep going. All right, my husband is a retired correction officer with Illinois, and I'm still working, and I'm on his group health plan. Okay. He's 61, I'm 64. Will I be forced off the group health plan? Okay. Well, not necessarily. But what happens in your situation is once you are 65, Linda, then that group retiree plan is only going to pay second to Medicare. So you're not going to be forced off. Let me say this: you can, if they're forcing you off, that's another issue. But as a general rule, that's not what happens. Normally, you can continue on. It would be a benefit that's still available to you. But the key is they're going to be in the second payer position. You're going to have to enroll in A and B for them to pay first. All right. Now, I have seen that happen, but usually states don't do that. Now, what I would do, Linda, is find out what does it cost your husband to continue to cover you in the second payer position. So if it costs him $250, $300 or more a month, and you don't have that great of a plan at the state, then I would drop the state plan and just get a supplemental plan or do an Advantage plan. But if it's a good plan, the price is good and all that, then the only thing is you got to enroll in A and B, and then the state plan pays second. All right, let's keep going. Okay, I decided to take A only. If all goes correctly, my wife retires in 10 years. As long as I can prove I have been on her insurance for that 10 years, will I need to have underwriting in 10 years? No, because once she retires and you're going to then apply for Medicare B to begin the very next month after her employer plan ends, then you will have that 6-month window of your B date to get any plan sold in your state without any underwriting. Okay, so that's the key to understanding what I was talking about earlier. The key date is the B date, not the A date. So what you did is fine. It really is fine. And again, you're right. You got to prove you've been on our insurance plan. Very simple to do. We use an L564 to do that, and it has to be active employment. When we look back from when you retired back to 65, the only plan that's credible is active employment provided insurance, not COBRA. Okay, just active employment. As long as you have that, you will be fine. All right, let's keep going. Okay, please discuss the signing up time limits for the Plan D and what are the penalties for being delayed, even if you have signed up for a supplemental plan. All right, so it just depends. If I'm coming into a Part D plan at 65, I have the same 7-month window to enroll into a plan. 7 months, 3 months before I turn 65. If I enroll, my Part D plan will begin on my 65th birth month. But I still have 3 months after as well. So I have a full 7-month window. And when you apply for a Part D plan anytime during that 7-month window, you're not going to be penalized. So let's just say this month is our birth month. April's our birth month. So I could have applied in March, I could have applied in February, could have applied in January, and my coverage would have started this month 4/1. If I apply for a Part D plan in the month of April, I'll start in May. Apply in May, I'll start in June, I'll start in July. And so I have April, May, June, July. So my last month of my 7 months is July. So I could still enroll with no penalties, no problems into a drug plan during the month of July, the last month of my 7 months. And my plan would start August 1. We'd have no penalties, no problems. All right. So that's the way it works at 65. So if I don't do it then when I should have, then for every month I don't have a drug plan, after August 1, I'm going to pay a 1% penalty. Now that 1% penalty is based upon the national average drug plan, which this year is right about $35. So that means 1% of $35 is 35 cents. So for every month I go without when I should have had a plan, every month it's 35 cents. So if I go without a full 12 months, that'd be 35 cents times 12, which would be what, $4.20 a month for the rest of your life. So you get a drug plan, they're going to add $4.20 to it forever. Okay, it never goes away. If I go without 24 months, that'd be $8.40 added to my drug plan. But penalties do not accumulate until my 7-month window has terminated. All right. Now the issue is this: I can still add a drug plan even if I didn't, but I can add one, but I can only add it during the Medicare AEP. And that's only once a year, October 15th to December 7th, October 15th to December 7th, for a plan that starts January 1. So again, every month I went without, I'm going to pay a 35 cent penalty for life attached to my drug plan. Now, if I came in Medicare at a later date using an SEP, meaning I kept working, I have a 63-day window from the time that group plan terminates to enroll into a drug plan. And if I haven't enrolled within 63 days of a group termination, then my penalties start adding up after that. Again, 1% a month until I take a drug plan. All right. So I hope that helps. And folks, listen, the penalties are not the most severe issue here. I promise you they're not. The biggest risk you run without having a drug plan is if you need an expensive medication. I had a lady the other day that needed Humira, and it cost $6,700 a month. Had another lady who needed Stelara, $13,500 a month. Self-administered chemotherapy pills range between $5,000 to $7,000 a month. And so you want a drug plan, not because of the penalties, though I wouldn't want a penalty, but you get it because all Medicare plans today have a $2,000 annual cap. As long as your prescription is in the formulary and it's expensive, you still will spend no more than $2,000 out of your pocket for the whole year. And if you don't have that $2,000 to pay out of pocket on your first fill, they'll spread that out over the remaining months left in the year. And so the whole point is get a drug plan. Even if it's a low-cost plan, it still has a $2,000 cap for meds that are in formulary. So get a drug plan. All right, let's keep going. All right, if I am employed and have a health insurance plan, should I apply except A and B? If you delay Medicare because you have insurance, is that advisable? If I join later, would the premium increase? Okay, number one, yeah, there's no premium increases because you took Medicare at a later date. Now, you're older, so in most states you're going to pay a higher rate. 67-year-old costs more than a 65-year-old. 70-year-old costs more than a 65-year-old, but it's negligible. Now, if you live in a community rural state, there's 8 of them, then everyone pays the same rate, but that's not the norm. The norm is we pay a rate based upon the age we are when we start the policy. Okay, so the key to your question, Sister Sage, is this. How many employees are on the payroll? If there's 20 employees on the payroll that we're talking about right now, the company, then you don't have to do anything with A or B if you have a good group plan. Now, if you have a lousy group plan, go on Medicare. Get a supplemental plan, get an advantage plan, whatever you want. But if you have a good group plan, you don't have to do anything with Medicare. Now, I think it's fine to do A only as long as you don't have an HSA. So if you don't have an HSA and you have a good group plan, enroll in A only. If you do have a good group plan and you do have an HSA, don't do A, don't do B. You're not going to be penalized as long as you have 40 quarters paid in the tax system. All right, so there's a lot to your question, but I want to make sure you also know that, yeah, when you join later, would the premium increase? Not because you didn't have a plan at 65 or 66. It would only increase just because you're a little bit older. That's all. And again, I promise you, it's not that big of a deal. If you have a good group plan, stay on it. All right, next. Okay, remember my HSA. I'm turning 65 on 6/30. Good, and I plan on starting Medicare B on 7/1/2025. My financial advisor told me that I could contribute up to the monthly maximum in my HSA until June. Okay, turning 65 on June. Well, listen, you can't contribute monthly max the month of June. So whoever told you that's wrong. You can contribute up through May, no problem. But what's going to happen if you apply for Medicare during the month of June, you can request a B date for 7/1/2025, but your A date is going to be 6/1. I promise you. They're going to give you a 6/1/2025 A date, and there should be no money going in your HSA as of 6/1 if you're maxing out. If you didn't max out, no big deal. But again, you're talking about maxing, so I'm sorry your financial advisor is wrong. It's not when you apply when it comes to A. They're going to backdate it, I promise you. They're going to backdate it to 6/1. So 5 months, you're great. After that, you've overfunded it, and your financial advisor needs to, needs some more instruction. Okay, let's keep going. All right, Shirley. I want to confirm that my husband can continue to contribute HSA through his employer if I enroll in Medicare starting June, my birth month, and no longer on his employer's medical plan. And you're exactly right. Yeah, what he is doing has nothing to do with your Medicare decisions at all. Okay, he can keep contributing to his HSA. All right, he can. No problem at all. I'm assuming he's younger or whatever, or if he's going to take nothing, as long as he doesn't have A, doesn't have B, he can keep contributing. All right. And you're fine. All right, August on disability since 98. Oh, A and B August. I guess you're talking about coming up, huh? Since 98. Okay, a few years away. 65. My birthday's in February. If able to afford in plan, when should I start Medigap in? No underwriting. I'll have a safe vacation. Thanks. Okay, so birthday's in February. So what I would do is back up the clock 3 months. So let's back it up: January, December, November. So right around November, and even a tad bit before in some states, 3 to 6 months in advance of your birth month, you can apply for your Medigap in, no underwriting. Now, that Medigap in is not going to go effective until 2/1 of 2026. So though we apply in advance, it doesn't start until we actually have hit our effective date on our B, okay, A and B. So the point is now you don't have to go through underwriting. I see you have A and B, so you're fine. You're fine. You have what we call, just so you know, this is called the IEP2. So when that in application goes in, yeah, they're going to see your A and B dates are earlier, but they're not going to care because they see that you have the second opportunity to get a Medigap policy at 65. So again, 3 to 6 months in advance of February. Hope that helps. Let's keep going. Why is Medicare A date backdated 6 months? Well, I will tell you, first off, know this. It's not backdated for everybody 6 months. If I'm going to start my Medicare when I turn 65, and I enroll in advance, it's not backdated. So when they backdate, it's backdated 6 months, or it's backdated to 65. The person whose question was just a minute ago, they said if they applied in June for a July 1 start date on B, they're going to be backdated, their birth month. Okay, so I just want to make that clear. Yes, A is backdated 6 months, or 265, whatever is first. All right, so I want to be clear on that. So if I am contributing to an HSA and I retire at 68, so from the date I apply, they're going to backdate 6 months from the date I apply. So the question is, why do they do that? Here's why. Because if someone, not everyone, but in situations where people are going to start their Social Security and they apply for Social Security, what happens is they are given a window to be able to decide when they want their Social Security benefits to begin. And with some people, those Social Security benefit options can actually begin 6 months prior, okay? So because it's possible to start your Social Security in some situations 6 months prior to when you applied, they automatically then backdate everyone's A date because of that rule, even though it's not applicable to many, many people. I think that's the reason they do the 6 month backdate on the A. Because you could be able to backdate your Social Security in some scenarios 6 months, and they just keep that consistent throughout on the backdating. Because once you have Social Security, you have to have Medicare A. So if they give you the chance to backdate your Social Security, they're backdating your A date. They have to. So that's why. A little confusing maybe, but it is correct. All right, let's keep going. If I start collecting on his Social Security, will I be automatically enrolled in Medicare A and not be able to continue to contribute to my HSA? Listen, if you start collecting any form of Social Security benefits, spousal, survivor, or your own retirement benefits, you will be automatically enrolled into Medicare, okay? And so you don't have to keep B, but you have to have A. So therefore, you cannot contribute to your HSA once you have begun your Social Security benefits. You can't. Okay, you cannot. You will have A. Don't have to have B if you have a group plan, but you're going to have to stay in your A. You cannot disenroll from A unless you're buying A, and that's only 1% of the population. Okay, so no new money can go into an HSA once that A date has been established, and it will be established because you are on Social Security. Automatically starts at 65. Okay. All right. Hey, by the way, this is going to sound crazy, but I want to clarify something to the previous question. And Brazil, if you can you go back? Is that possible for just a second? If you can't, I want to clarify something. Let's suppose that somebody is on Part A, but not Part B, but they're on Part A, but they are continuing to be covered by a group health plan of their spouses. That spouse can continue to make the max family contribution. It's one little kind of, I want to say loophole, but it's one exception to the rule. Let me say it again. So if I'm enrolled in A only, and let's say I'm covered, I have A only because I'm on Social Security, but I don't have B, and I'm covered by my spouse's group health plan, my spouse can still contribute for family contribution, which this year I think is $8,500 plus $1,000 catch-up for one of us. So that's when you can continue to contribute to an HSA as long as it's family, and you're still covered by that group plan at work, okay, of your spouses that has the HSA. It's the way it works. So that's the exception to the rule. Let's keep going. Okay, trying SCP. Had 9/20/23 at 65. I don't have B. Run out of company insurance in April. I need to take COBRA. Won't have B by then. You're right. Need help. My company is slow on this. Okay. All right. So here's the thing. Salvador, the biggest issue for you is if you can't get that L564 filled out by the employer, okay, if they're slow on it, you actually can submit the L564. You complete it, don't sign it. You complete it, and you put a sticky note on that thing saying, this is accurate information, meaning you're telling the truth about all the employment dates, insurance dates, all that stuff. Put all that on there. And then you put a sticky note on there and say this. Say, my employer has not gotten this to me. I need to start my Medicare 5/1 of 2025. And I would almost guarantee you, Salvador, your local office will process that request. So you can fill out the L564 and sign, do your 40B, make sure you're requesting your 5/1 start date, and I think you'll get that through. I have seen it happen. But tell them why you're doing it, why it's unsigned. All right, we'll see what happens. That's exactly what I would do. So you're fine, okay? So I need to take COBRA, won't have B then. So the bottom line is you don't want to take COBRA. Don't do that. Go ahead and request your Medicare 5/1 to start. I would, now here's the thing with COBRA. You usually don't get the COBRA notification for 30 days after you're done working anyway. So if you've got all this set up with Medicare the way I'm suggesting, you won't have to pay that premium on your COBRA anyways. All right? And so you're fine. And by the way, do me a favor, Salvador, call us. Any agent you call in my company is going to be able to walk you through how to do this. But I'm telling you, I've seen it time and time again where the L564 was not filled out by the employer. Some refused, some drug their feet, and we just do it without signature and see what happens. Okay, let's keep going. If I'm 67 and working, I have an employer plan with Cigna, $173 a month with dental. PPO, that's good. Medicare B, my plan G, $154 each, $84 a month. And Medicare B, plan G. Okay, yeah, I think you are. Now, Joe, if you're the only one covered by that employer plan, then yeah, I think you're overinsured. I wouldn't waste the 173. Because you have everything else that you need. Yeah, you are overinsured. I may need surgery in the future. Okay, but listen, Medicare is not going to have. There's no prior authorizations for knee surgery. So A and B is going to pay first. Your G plan is going to pay everything but the Medicare B deductible. This year, that's $257. So you're paying 173, and frankly, the way it works, and if your group plan has 20 or more, your group plan is paying first. So you're way overinsured if there's 20 or more, because your group plan pays first, Medicare pays second, your supplemental plan pays third. So if you can drop that group insurance, that's exactly what I would do. Yeah. And if you have a good group plan, that 173, then and you're going to keep working and stay on that plan, man, I would drop off the B and the G. But if you're going to quit working within the next 60, 90 days, I wouldn't do that at all. That's too much hassle. But if you're going to work for a couple more years, it may be your best interest to drop B and drop the G plan. and then as long as you stay actively employed, you can pick up Medicare at a later date, Medicare B, and a supplemental plan in the future. And you can drop your drug plan too if that Cigna plan is good. But again, it needs to be a good plan, and more than likely, it's probably not that great. So then if I'm going to drop anything, I'm going to drop the group plan. And so talk to your employer, see when you can do that ASAP, okay? Because you got great insurance with A and B, G, and that United Healthcare drug plan. Okay, let's keep going. All right, do you have any tips for federal employees of Blue Cross people trying to decide between keeping the Fed plan or going on Medicare G? Well, I do, Vel. A couple things. Know that if you go on a Medicare G plan, and I think G plans are great. I think N plans are also very, very good. The issue with UVEL is to do a G plan, you are going to have to terminate your FEHB benefits. Terminate. And there's a form that you have to fill out and send to OPM to terminate it. Now, again, the reason people do that is because they're not happy with their federal plan. Blue Cross or GEHA or whoever, or not happy with the premium. And sometimes just traditional regular Medicare with a supplemental plan makes more sense. But just know, for you to drop your premiums for your Blue Cross Blue Shield plan out of your annuity check, you have to terminate those federal benefits. So I don't know if you have a spouse or kids covered by the plan, and if you're comfortable terminating, then that's how you get a G plan. What a lot of people do with the federal government, if they're afraid of terminating, what you can do is a couple options. You actually can suspend FEHB, and get a good Medicare Advantage plan, or you can keep your Blue Cross Blue Shield plan and enroll in what's called an MA only plan, MA only. So you get your meds through Blue Cross, but all your health care would go through the Medicare Advantage plan, and then your Blue Cross plan pays second, because Blue Cross will coordinate with Advantage plan or they'll coordinate with A and B. Okay? And the reason some federal employees do that, they keep Blue Cross and have an MA-only plan, is because when you have an MA-only plan, you get a credit not only from Blue Cross by enrolling in A and B, but you'll get a credit from the Advantage company anywhere from $100, $150 a month to offset your Part B premiums. So now that may be confusing to you, but that's an option. A lot of people do that. And you can call in and our agent can kind of walk you through that. But just know if you get a G plan, you definitely are terminating FEHB. That's permanent. All right? Or you can suspend it, or you can keep it and do an MA only plan. So you got a couple good options available to you, and we can discuss all that with you. Okay, let's keep going. All right, I'm on SSD, Social Security Disability, have only Medicare, 55 years. Why is only Medicare Advantage good for me, and why can't I have a med sup plan? Is it because of my age? Yes. Okay, Georgiana. Let me say this. If you're new to Medicare, I know you're on Social Security Disability, 55, and you're still within 6 months of your B date. If you live in a state that requires supplemental plans to be offered to people in your situation, then you can get one. But if you're beyond 6 months of your B date, you're not going to get one, even if they're available, until you turn 65. At 65, Georgetta, you'll be able to have a second opportunity then to pick up a Medigap policy, and no underwriting will be involved. And so you're saying, is a Medicare Advantage good for me? Well, it may be your only option. Most states, that's your only option, because most states do not require insurance companies to write Medicare supplemental plans for those under 65. They just don't require it. So Medicare Advantage is tons better than having A and B with nothing else. Okay, for sure. Because with A and B and nothing else, you have no max out of pocket established. Sky's the limit financially. A lot of financial risk. So definitely an Advantage plan is a much better option than A and B only. Okay, hope that helps. Let's keep going. Alrighty, I have COPD and memory issues. Should I look into a SNP plan even though I will be on Weiss plan for 10 more years? Okay, well, I'm assuming by your saying you're familiar with SNP plans. By the way, those of you that wouldn't be familiar with this acronym, it stands for Special Needs Plan. And there are several special need plans available, and there are some of those available for chronic conditions. And the chronic condition could be COPD. So should you It just depends on how much it costs your wife to cover you. So I would say if your wife is spending $250 a month or less to have you on her plan, and it's a good plan, then I probably would not do A and B with a SNP plan. I probably would just do A only and be on your wife's plan, and then pick up B at a later date. Excuse me, I'm really sorry. So if the group plan is good, have A only. But if the group plan is not good, then I would have A and B, and I would then consider a SNP plan. But when you do that, you got to realize that you're going to need to drop your wife's plan because, number one, she's paying for it. Number two, if it's a large group, they're still in the first payer position as long as she's actively working. All right, so there's a lot that goes into your question. So hopefully that's helpful. Yeah, you have multiple scenarios here that you can look at depending upon really the cost of what it costs her to cover you. That really is the determining factor. So if I knew that, I could tell you more or call in and talk to one of my agents. They'd be able to walk you through this perfectly and tell you if it makes sense or not to drop her plan and go on a dual SNP plan. Okay? Not dual SNP, chronic SNP, sorry. Okay, let's keep going. Okay, if you have a pre-existing condition like cancer, can you get on a plan G, or what is the best plan for me to get on? I have to sign up for Medicare A on May 1st. Okay, well, Sarah, you do not have to worry about pre-existing conditions if you're starting your Medicare B. You have a 6-month window before B and 6 months after where you can apply for a Medicare B, a supplemental plan, and they have to accept you. It's all tied to the B date. So we can apply 3 to 6 months in advance. But if I haven't, I still have 6 months of my B date where I do not have to go through underwriting to get a supplemental plan. Now, after 6 months, then your cancer could be an issue, especially if it's active. Now, if the cancer was 3 years ago, 5 years ago, 10 years ago, and you're cancer-free, treatment-free, it's a non-issue. But if it's active, then it is a big deal, but not during 6 months of your B date. That's that Medigap OEP that I talked about earlier, okay? All right, let's keep going. What is the name of the travel insurance you talked about a while ago? Okay, well, travel insurance that I would look at would be through a company called Travel Insurance Center. Travel Insurance Center. And they're brokers, so they write for a lot of different carriers, and based upon where you're going and what kind of coverage you're looking for, that's who I would call. And again, we don't write travel health insurance, but let me just give you that number real quickly. I'll give it to you. I've got my contacts here. As I travel, that's who I use. I'm sorry, let me give you real quickly. Travel Insurance Center. It is, here we go. It is 866-979-6753. 866-979-6753. Tell them where you're going, how long you're going to be there. They'll give you some options. Probably we'll have an air evacuation rider as part of that. All right. I use them a lot. I like them. I've also, when I went to Israel, I actually used American Express travel insurance. They did not rate up my trip to Israel. They just treated it like I was going to, Italy or something. There was no rate up. So I like that with American Express. But just be sure to read the fine print on these policies. You all make sure it's a really good policy because some of them are junk. But I don't think you'd get that with Travel Insurance Center at all. I think you'd get good service. All right, let's keep going. Michael, do the premiums on the Medigap plans increase yearly? If I start on a plan like G, can I switch to an Advantage plan after a couple of years and also would be able to switch back to a Gap plan? Okay, Michael, yes, supplemental plans are going to increase yearly. Now, historically, those increases have been in the neighborhood of about 5 to 10%. However, because of all the medical inflation and all the COVID issues and people delaying coverage delaying health care and then really ramping it up afterwards, we have seen costs much more higher than that. Okay, I'm just saying traditionally it's been 5 to 10%. Last couple of years it's been more than that. Okay, so they are going to increase yearly. Now that's the norm. So I'd always plan on that. Now, you're asking me if you start on a G, can I switch to an Advantage plan after a couple of years? The answer is yes. Now, you can only do that once a year. There's a lot of switching periods at times and rules, but from a SUP to an Advantage is once a year, October 15th to December 7th. You make a decision to move on to an Advantage, and your Advantage plan goes effective January 1. That's when you can do that every year. There's no underwriting involved at all. Now, if you start with a SUP and move to Advantage, on that Advantage plan, you have 1 year to try. It's called the trial right. Anytime during that first year of being on that Advantage plan, if you don't like the Advantage system, you can go back to that original supplemental plan that you had. Can't go back to just anything you want to go back to. You can go back to the original one you had, though. That company has to take you back within 12 months of that Advantage plan. So you have 12 months to try that. All right, that's the way it works. So we just can't go willy-nilly back and forth, do what we want to do without some rules, but you do have some flexibility initially. Okay? All right, let's keep going. Michael, is there an income amount to qualify for an Advantage plan? No. The only thing that your income matters, if it's high income means you're single above $106,000, married filing a joint return above $212,000, you pay extra for your Medicare B as well as your drug plan and your Advantage plan. Okay, so you pay more. If you're low income, then where that would come into play, now again, it's not going to affect your Advantage plan, but it could mean if you qualify for Medicaid, you may get a different type of an Advantage plan. That would be called the dual special needs plan, dual eligible, meaning I'm eligible for Medicare as well as Medicaid. All right, so that's when income comes into play. But as far as the cost of plans, there's really no difference in that at all. Okay, let's keep going. Can I work on SSDI? Yes, you can, but it's only you can only make a certain amount of money. You're gonna have a limitation on that. They call I'm actually forgetting the term for that right now. Yeah, it's like qualifying work. They let you make so much money, and then if you get above the certain limit, then you could lose your Social Security disability. But you definitely can work while on Social Security disability, but it's going to be limited amount. Okay, and frankly, they like it when you do that for sure. All right, let's keep going. All right, you folks just got me signed up for G&D. Should we get a dental plan right now also? Well, Lori, maybe. If you want a dental plan, the best time to get a dental plan, if you want one, would be within 30 or 60 days of losing a group plan, like at work, because then you don't have any waiting periods, any delays in coverage. So 30 to 60 days, as long as we can prove that you did have a dental plan, we have to have the name of the company and the policy number and all that, then we can submit that with the dental application, and you have no waiting period. You're immediately covered on everything. So that's the answer to that. Now, if you didn't have a group plan, dental insurance, then it's totally up to you. You can add those at any time. But if you have a waiting period of 6 months on basic and 12 months on major, hey, I say if you want one, get the clock going, get it started. The sooner the better, really, for you. Okay, I have a dental plan, and I'm glad I do. All right, let's keep on. Okay, very good. I guess we're done. So, folks, thanks for watching. I want to let you know that I do have an event next Monday, next couple Mondays, but our event next week, we'll notify you about that. I may have some other of my coworkers be a part of that, as I will be out of town next Thursday. I'll be back the one after that, but I'll be gone next Thursday. But again, just watch our channel, and we'll keep you up to date because there may be some other employees who will take care of this for me. So thanks so much for watching. It'll be our privilege to help you. Reach out to us and let us be your broker. I promise you, you won't be disappointed. Thanks a lot. Take care.